An informed consumer is what's going to bring the economics of healthcare costs into line. I will bet on an informed consumer every day. If we're going to try to bring healthcare costs into line, we're going to have to disclose the prices and allow people to make choices. We can't continue on the path we're on with healthcare costs being the leading cause of bankruptcy. Healthcare is not as complicated as everybody wants you to think.
The hospital price transparency movement is gaining ground. A new federal law is requiring hospitals to post their prices, but where does that leave independent doctors? Many would like to show their patients their prices, but they don't know where to begin. And they're afraid. They're afraid that hospitals will get upset with them, and so will commercial health plans. They also worry that they might upset other doctors that they compete with. Just ahead, we'll see how 3 different practices have overcome these concerns, and you'll be introduced to a couple of different software platforms that hundreds of doctors are using successfully to post their prices.
I'd get these calls and text messages from my friends, and they'd say, Mike, my kid hurt his knee playing soccer today. I tried to get him in to see you, and your staff wouldn't make me an appointment. It's not that there wasn't availability. It was the fact that I don't have insurance. And they'd make it clear that they weren't looking for a freebie. They were willing to pay, and my staff was turning them away. And it just drove me crazy. And we need to get these people in. So I created a software platform to address this.
Everybody wants to know how much they're going to have to pay out of pocket, whether it's medically necessary or cosmetic. There was really only 2 ways to answer that question when people were calling, asking about pricing. One was to explain all the pricing to them over the phone, and then they would say, all right, thanks, and they'd hang up and you'd never hear from them again. The other option was to say, oh, we can't go over that over the phone. We can't really tell you until we see you in a consultation. And that just aggravates the hell out of patients that you won't refuse to give them a ballpark figure. And then I started to realize, we have the prices. We have it on a spreadsheet. When the patient comes in, the office manager goes over the cost of the procedures. We just need to find a way to digitize that to provide it to the patient ahead of time so they have a better idea what's going on. So that's when I had the idea of coming up with this platform, Build My Bod Health, where we first started it within my practice, where the consumer could come to our website, go through our price estimator, choose the procedures they wanted, and so they would get that automated email sent to them with a breakdown of cost.
Most of our work is elective, and therefore it's kind of a one and done. We have about 100 procedures that were fairly easy to package, but if we can do those procedures in our surgery center, then we have control of the surgery center cost. We partner with anesthesia to bring a reasonable piece of that pie into the bundle, and then we have the surgeon's fee and whatever office care is needed before or after the surgery.
95% of the patients I see with a sore knee, I do the same thing. I spend some time with them. It's maybe a level 3 office visit. It's an x-ray perhaps. And we figure out a plan to get them feeling better. So what we did is we bundled a number of office visits, and we came up with just reasonable, transparent pricing, taking into account the fact that we don't have to spend money to collect on these folks because they pay at the time of service. People are set in the third-party payer model. Everybody's thinking ICD-10 and CPT codes. Take a step back and think more of the services you're offering the patient and the treatment you're offering them, as opposed to try and tag everything to an ICD-10 or CPT code. In the traditional model, it's easier for the staff to just turn these folks away. A self-pay patient calls or someone inquires about self-pay. Here's the packages your practice offers. Here's what you tell them. Go to the practice website and click on the pricing tab and buy the knee package.
I struggled to figure out how to make it look nice and appealing and easy to understand for the patients. I was introduced to Health Me, Dr. Havig's product, and it was what I was looking for. It's a bit of a plug and play model, and it's easy to lift in that way.
Or how do you manage the relationship with your commercial payers? Because I would hate to recommend that a doctor go forward with this and then lose their biggest commercial plan as a result.
One, are you happy with your commercial insurance contracts? And if you are, then our suggestion is you price these direct pay packages similar to your high volume commercial insurance contracts, not like the one that you see one patient a year and they pay you your full fee, because that's very rare, but your BCBSs and your Uniteds and all those others, Aetna, because I think if we're willing to take that from a commercial insurer and we feel it's fair and reasonable, why wouldn't we take that from a self-pay?
This is really where the site of service differential comes into play when you're talking about hospital-based services and hospital employed physicians versus private practice physicians and ambulatory surgery centers that are owned by independent practices or physicians, because we already are the lowest cost provider for an insured patient. We are not paid exorbitantly at all. I might argue we're underpaid by carriers for those services. In our world, the prices that our cash prices we're displaying are not undercutting our carrier. What we're trying to do is give an equitable solution for people who don't have the benefit of insurance.
19% of working age adults in Florida, age 19 to 64, don't have health insurance. That's a fifth of all the patients. That's a fifth of the market. And right now you're missing that market.
Premium costs of insurance have just gone through the roof. So if you are not lucky enough to have an employer sponsoring your plan, many people cannot afford it. It doesn't mean they don't have money. It doesn't mean they're not working.
Practice managers who look at what we're doing saying, well, gosh, I don't want to grow my self-pay. Why would I want to do that? Self-pay is no pay. And so part of what we're doing is educating them that these are patients that pay. And using our platform, the patients pay in advance and the money's held in escrow, so you know you're going to get paid. But you should be trying to attract more of these folks.
In the past 5 years, that business of people who can afford to pay and are uninsured, in my mind, is an untapped market. And those people are the ones that are savvy about looking for pricing, and they know the questions to ask. But if you make it hard, they're just going to move on.
3 of the things that doctors don't want to use price transparency: 1, they're afraid the patient won't understand that it's an estimate. Secondly, they feel like they can't provide a good estimate until they see them, which, somebody needs a gallbladder out, they need the gallbladder out, you know what the procedure is. And then thirdly is that exactly, they don't want their competitors checking their pricing. The race to the bottom, I understand that they're worried about that, but I think it's completely unfounded, because that you showing your pricing does not require you to lower your prices. That's you choosing to be thinking that that's a competitive way to be, and it is a race to the bottom, but you don't really have to do that.
In terms of being afraid of your payers, again, I just venture to say that for most of us that are independent, you're not being overpaid by your local carrier. If you set your prices kind of even with theirs, you could even go a little bit higher. It's still going to be a very fair price for the cash pay person, and it shouldn't poke the bear, so to speak.
And we've seen this across the country. People who have gone out, opened up ASCs, and they're doing the knees, they're doing the shoulders at a fraction of the cost. Well, the hospitals don't want people to know that. There's a reason why they don't want to post their prices, because they know if they post them, an informed consumer is going to make a better choice, which is then going to force the hospital to reduce their prices to be competitive, a true competitive market.
If you guys show your prices, the hospitals get nervous. So I talk about that. I have heard about, in fact, an orthopedic surgeon who posted his prices and the hospitals told him to take it down because it made them look bad.
I bring them a lot of business, millions of dollars of business a year, and they don't always treat us like a valued customer. And so just my number one message to any hospital administrator would be, work with your independent physician. We're bringing you cash. Instead, my goal is to get doctors to embrace this transparency movement, give them a platform that makes it easy for them to do that, solve the pain points that they and their staff have in dealing with direct and self-pay patients, and do that all for a reasonable fee for all parties involved. Right?
And so we started generating leads right off the bat for people checking pricing. And so over that 1 year, I was able to generate enough good data that I actually wrote a paper about this that got published in a scholarly journal. I was able to start going around to different meetings and talking about the benefits of price transparency and the data that I showed of how it was more efficient, more people would book when they came in, and also trying to explain to how non-plastic surgeons how this also would benefit you for insurance-based procedures. We've expanded out of just cosmetics. It's bariatric surgery, dermatology, general surgery, gynecology. So we allow the consumer to not only check pricing on maybe just cash pay services or bundled services, but they can also determine their out-of-pocket cost using their insurance. We do show the lowest and the highest negotiated rates for a specific procedure outside of that particular person's insurance plan. It really is a very efficient way of handling all those pricing questions, and it really takes a lot of the pain and suffering off of the front office staff who are having to deal with that. We have over 250 doctors or facilities using our platform now.
What our platform does is it really opens this type of model to the majority of other physicians, and we give them the opportunity to access this direct pay market. Currently, approximately 400 physicians onboarding as we speak, that we hope to have onboarded in the next few months. By the end of the year, we hope to have 1,000 physicians on the platform.
I don't think independent doctors are opposed to posting their prices. I think what independent doctors need is some sort of assistance to give them the financial wherewithal. They don't have these facility fees and these increased reimbursements to be able to afford, all this infrastructure. And so I think a lot of it has to do with somebody coming up with an affordable software solution.
This is the main page of our website. And then you'll notice here in the corner, we put a pricing tab. There's some disclaimers in this that explain that we are offering bundle payment options for those seeking to pay directly for care apart from an in-network insurance plan. That's important because currently all of your in-network plans, there are some requirements that you as a participant in that agreement have. So we're not trying to talk people out of using their insurance. And I think that's part of when providers are afraid to do it. I mean, this is another safeguard. All right, so now we have several categories: office visits, surgery, MRI, and therapy. So if you just have some knee pain and you want to find someone to check that out for you, they're grouped pretty much by body part.
They're very consumer centric. You can see, so back or neck care, shoulder care, hand, wrist, or elbow care. You don't see any ICD-10 codes. You don't see any CPT codes here. But if someone wants to buy, for example, the knee care package, which I mentioned previously, you'll see a list of providers that offer this. And so there's some doctors in their practice that offer it. There's the price. So there's a doctor profile with some information.
When I pay, I get an email back confirmation with a redemption code.
And when they show up at the practice, they enter that redemption code. And they're usually paid immediately, but we guarantee payment within 72 hours.
These are big bundles. So these prices are high because these prices always include the surgeon's fee, the ASC facility fee, anesthesiologist fee. Some of them include implants, some don't. This is a nice list, and there's about 100 on here. The hardest part of all of this was not creating the prices. It was creating the workflows behind the scenes to map it back. So patients don't care about those blasted CPT codes. There's like 10 different shoulder arthroscopy codes, but generally the same. And the price is always the same for those. Just lump them in a bucket. But I still have a big spreadsheet on the back end that has each of those mapped back to a CPT code, because that's still how we have to enter it in the system.
So this is some bundled pricing that we have specific with a general surgeon and a bariatric surgeon in Georgia. He includes all of his procedures, his bundled rates here. This is a great example of all of these procedures he has listed, like gastric band port placement, endoscopic sleeve gastroplasty. These will provide you with the total bundled rate. It shows the doctor's fee, the OR cost, ancillary fees, talks about how long he's going to be in the operating room. It shows a whole breakdown. So the total estimated amount is $12,000. So that answers your question about bundled rates specific to doctors who are able to do procedures in an outpatient setting.
What are the benefits to the physician for price transparency, and then for the patient?
Service benefits are the patients don't come in completely oblivious to how much it might cost. So there's no sticker shock. And one of the things we found was that patients who come in knowing price ahead of time are 41% more likely to book a procedure than non-price aware patients.
Obviously, what's nice about it, they pay in advance. So we don't have to chase the money at all. There's no pre-certification requirements. There's no claims filing. The platform issues a receipt.
What final words of advice would you have for physicians who are hovering between staying where they are and moving into the sunlight?
Why not give it a try? I mean, there's not a commitment. You don't have to keep doing it. But I think once practices start doing this, they see that it helps grow revenue. It simplifies the process for their doctors and their patients and their staff.
Don't get overwhelmed and intimidated by how hard it seems.
You need to embrace it. It's not going anywhere, but you really need to jump on board.
This gives us a huge opportunity as independent physicians really to take the lead on this.
This is definitely not necessarily a race to the bottom, and it definitely doesn't just work with cash prices. Please put that out of your mind that this only works for cosmetic cash prices. This works for everybody.
At the end of the day, It's the consumer that's being harmed if you don't do this. And I don't know any industry that doesn't do it.
What do you think the future of transparency is? Is it inevitable or is it impossible?
I think what we're going to see is a transition towards more transparency, which I think is going to benefit consumers and business owners and doctors alike. There is so much initiative behind transparency in healthcare costs. Employers want to know this. Patients want to know it. I think most doctors want to provide it.
I think we have a window of opportunity with a spotlight nationally on this issue to be the good guys. I feel like we are the good guys.
Transparency, what's important about it is it's going to allow a market, a true market, to establish prices. I think we're at a point right now that transparency is going to be the answer.